Welcome in. We're just letting folks in from the waiting room. Excited to start our alumni panel with our IHeLp nurse practitioner alumni guests that are with us. I'm going to stop sharing my slide deck here in a second so we can actually all see each other together, and feel free to turn your camera on. Great if you can. If you can't, or it doesn't work out, don't worry about it. The way that we'll run the alumni panel is I'll be asking questions to our guests, and then the last 15 minutes we'll hold for all of you to ask your questions if they hadn't already been answered at the beginning. And then if there's any time at the very end, I'm going to walk through a couple aspects of our IHeLp program and application times. So I should start with, I'm Molly Burke. I'm Director of Online Education here at the Andrew Weil Center for Integrative Medicine. I am also Program Director of the Integrative Health and Lifestyle program, which our alumni are part of. And I'm going to go ahead and no, I think, do we want to highlight, let's highlight our panelists maybe, Morgan, make that easier. See, you're all going to get spotlighted. Get ready for it. Oh, it all went away. Let me try that again. We should be able to do 3 spotlights here. Go, there we go. And just in case you actually want to see the person asking the questions, there you go. All right, so we have Grace, Veronica, and Dana here, and I'm gonna start asking questions. Veronica, would you tell us a little bit about yourself, where you're joining us from, what's your professional background, and what are you currently doing professionally?
I am joining you from Richmond, Virginia. I'm an adult nurse practitioner and I work in rheumatology. And I've been doing that for a million years now, it feels like. And what else do you want me to say?
Or that's what you're currently doing, yeah?
Oh yeah, working in rheumatology in a hospital-based office. Currently the only provider there. So using all my techniques I learned in IHeLp. But it's great, yeah.
Awesome. Grace, can you tell us a little bit about yourself, where you're joining us from, and professional background?
Hi, everyone. I'm Grace. I'm calling in from New York, New York. I have been a nurse practitioner for about 4 years now. I previously worked in surgery for probably almost the 4 years, and I actually recently got a job in integrative medicine as a nurse practitioner at one of the hospitals here in the city. I'm actually also currently in the Integrative Health Fellowship at University of Arizona. So it's definitely a good journey, busy, but it's honestly a good ride right now. So
Wonderful. And Dana, tell us where you're joining us from, professional background, what are you currently doing?
Hi, I'm Dana. I'm in Phoenix, Arizona. I've been a nurse for about 16 years, with the last 10 being as a nurse practitioner. My nursing background was more trauma ED, but for the last 8 years, I've been a hospitalist at the hospital. Don't really have a whole lot of exposure in integrative medicine yet. I did trial a job at a clinic doing that, and I did get a Reiki certification as well. So I'm starting to open my own practice doing that and trying to figure out how to incorporate the both of those.
Nice. And we were just talking, you got board certified in holistic nursing after IHeLp.
Yes, I did take the board certification exam shortly after that. Yeah.
Dana, will you tell us, for nurse practitioner, what are some of the benefits of graduating from our integrative health and lifestyle program?
So I think one of the things that's helped me a lot, especially in practice in an acute care setting, is having that education, that certification helps kind of some of the other providers have trust in what I'm saying and presenting, because not a lot of people follow this type of medicine. And they do tend to take me a little bit more seriously, especially a lot of people know who Dr. Weil is and know about the program at the University of Arizona. So I think that has helped me. And then it's also the networking that is involved with the program has been extremely helpful. There's been several people I've kept in contact with that I attended the class with, and even just the alumni site, having that networking, job postings, CME education webinars, newsletters, all those kinds of things all in one has been really helpful in this area.
Awesome. Thank you. Veronica, you agree, disagree, other add-ons?
No, I agree totally. What's nice is, it's helped me personally. Everything that we learned, what's nice about this program is you're not just learning to take care of others, you're learning how to take better care of yourself. And like Dana said, a lot of my coworkers who don't have a lot of experience in it will come to me with, for questions or for advice. And the patients are very interested. I work in autoimmune disease, and that it's very tied into mind, body, and spirit. And so, you develop patients where I am. I see the same, group of patients frequently. And so we're kind of invested in each other's stories. And they knew I was in school, and they were so happy about it because it's an interest they have, but it's not an interest to all health professionals. And so it's nice to be, one of the ones that they can contact and talk about the alternative or integrative medicine that some won't talk to them about. So it's been a really good journey through the program and after too.
Awesome. Grace?
Yeah, I'm gonna echo what Veronica and Dana have been saying. It's definitely a personal and professional journey. When I had taken IHeLp, I actually had quit my surgery job without a backup plan. And I was like, okay, if I'm gonna invest in something, I'm gonna invest in myself and I'm gonna invest in my education. So honestly, it was one of the best investments I made. It's a good leveraging point because integrative medicine is so specialized. Obviously, it's very much up and coming. And so I remember actually after I took the IHeLp class, I sort of, was looking at jobs in integrative medicine. I mean, I had applications that were denied because I had zero experience in the field. So I think it's a good leveraging point to get your foot in the door or interviews in the integrative medicine space. The mentorship was great as well in the program. I mean, I've never felt so supported in like a educational space. And as Dana said, I still keep in contact with some of the people from IHeLp, mentors and peers. But yeah, it's just it's a great investment all around in yourself and in your professional journey. So definitely well worth it.
I'm gonna go a little off script because you're both talking about the professional and the personal, and of course self-care is woven throughout the IHeLp program, where you might learn about sleep, but you're also going to look at your own sleep health and come up with some self-care practices. Give it a shot and see how you might make healthy behavior changes to support yourself. Was there an area during the self-care that each of you were like, that I just like, that one sticks out, that self-care practice?
For me, what was interesting, I feel like I got into the program at the right time because it was, around the time of COVID. And I think it wasn't 2023 the first group to come back, like,
In person?
yeah. And so it's COVID, you're a little burnout, it's been stressful. No one really knew initially what to do. So resiliency, one of those core principles, really, really like, it was like cling, okay. But yeah, that I think it just came to me at the right time. Yeah.
Nice. Dana, do you have one?
It kind of ties into one of the other things we were going to talk about. So, for me personally, I was 6 months pregnant. And so I don't think I had one. I think I had so many that tied in. And it was super helpful for me for pregnancy and labor and birth and incorporating all the self-care aspects. And that's what I did my final project on too, trying to go through with a natural birth. So that whole part of it really tied in for me. And then another big one was all the aspects of sleep. I've always been a poor sleeper, so that section was huge. So yeah, that was really helpful.
Grace?
I would probably say the mind-body medicine niche. I mean, I had been meditating before. I was like joking with my group when I had joined IHeLp. I'm like, when you live in a place like New York City where you're constantly overstimulated by all the noise and everything going on, you have to meditate longer. So I was always meditating for at least 45 minutes a day. But the class really helped me hone in on those skills and really understand, the benefits of meditation and yoga and things like that. But especially now in my job, I'm realizing it doesn't matter if a patient is coming in for, an autoimmune disease or gut issues or, anything. Really, the mind-body medicine aspect is really important for anyone because it starts with that. And of course, other areas too, but I just personally felt, guided towards that area the most.
Grace, I'm going to stay with you. What are one or two elements from IHeLp that were most meaningful or impactful for you personally?
Oh, definitely the 1 week retreat. It was very transformative, and I'm gonna have to give everyone a heads up. I don't know if this happened to you guys, Veronica and Dana, but there was a lot of crying going on during one of the exercise activities. It got really personal. It's, the safe space that was created, and it really allowed people to really open up, to be honest. And I think there's a lot of release and that needed to be going on as a collective whole, but personally within people. But definitely the retreat, because it's very transformative in terms of personal journey and of course professional. But then I would also say probably the mentorship. I really loved my mentor because we had the projects. You got to choose a project to do. And Becky was amazing. She, you could tell she cared. She always gave like thorough feedback. We had like heart to hearts. I told her, I'm like, I really want to do the fellowship, but I don't think I'll be able to do it. And she's just very encouraging. Again, I'm going to emphasize the support that we got in the program. It was very profound and it was very much appreciated.
Get to see her next week.
Oh yeah.
The retreat.
We'll tell her I say hello.
Well, you will. Dina, one or two elements of IHeLp meaningful or impactful to you personally?
So the one I had touched on before, just with the pregnancy, it was really helpful. A lot of aspects being acute care, I don't learn a lot about pregnancy and labor. So just with the essential oils and the aromatherapy and different herbs and everything that I learned through pregnancy was great. And then the other thing, absolutely 100% was the retreat. That was incredible. Just the bonding we did together. When we shared meals, there were so many deep conversations. And probably my favorite part of that was when we had the circle with the drums and the singing. So I agree. There was a couple of those circles. I know I cried in one of them, and there were a few people that had some emotional moments. So yeah, just sharing that with everyone was really great.
Yeah. Veronica? Oh, muted.
I would agree with Grace and Dana. The retreat really it was amazing because it did feel like a safe space. You're there with like-minded people. You're opening up in a way that you wouldn't normally think you'd open up. You get to know these people online, but to meet them in person was really nice. And then I really liked our self-care teams. Like we broke off into our groups. I loved my mentor too. Fred's amazing. I still get his weekly reflections. He's great. And our group was really great too. And it gave a lot of time to discuss with others, but also the assignments or the lessons gave you time for a deep reflection. So it was just a lot personally. It just meant a lot personally, and it made you during that. I mean, we weren't in the height of COVID, but we were still coming down from that stressful time period, and it gave you time to recenter yourself. And reflect back on why you're doing this in the first place, what matters to you most, just all the reflections. It really made a difference. It really helped.
All right, Veronica, I'm gonna have you go with this is the last round of questions, so everyone get your questions ready in the audience. What are 1 to 2 ways you're incorporating what you've learned from IHeLp into your professional life?
Oh yeah, it's like I said, autoimmune disease, that is definitely mind, body, spirit. So I luckily can set time for my appointments so I can reflect or help the patient reflect on what they need to work on. We can address more nutrition or movement or sleep, pick some things that are important to them and incorporating that into their medical treatment. Don't just focus on just like take this medicine and come back and I'll see you in 3 months. I can ask him more questions. Are you moving your body? What kind of foods are you eating? Talk about your stress level. All of that makes a difference. And it's nice to see that change in the patient. And like I said, most of these patients, I would say especially autoimmune patients, but I've observed it in other patients, are very into integrative medicine. They know that it's not just the medicine that's going to make them feel well and feel good in their body. So it's nice to have those conversations and be equipped with the tools to help them and the language to help them so they can improve their mind, body, and spirit.
You know,
So, not long after I had my Reiki 1 when I went into this program, but then learning everything we learned, and how Grace had mentioned the mind-body connection really drove me towards energy medicine. So I did end up getting my Master Reiki and Master Reiki teacher and opened my own business to try to incorporate that. It is a little hard to try to figure out how to separate it on a professional level. Because as an energy practitioner, you do have to remember you're not doing it as a nurse practitioner in that moment. So that has been a challenge trying to figure out that part of it. And then in the hospital, it has been challenging to try to bring some of these things in because you don't have all the time that you would like. But speaking of Fred, motivational interviewing was so helpful. I just go into patient rooms different. Even if I don't have all the time I would like, I ask different questions and they can tell that you're more empathetic. They can tell that you care about them as a person and that they are a person and not a number. And I found so many more patients just opening up to me completely differently and uncovering things that I don't think they would have told us otherwise, just about their personal life and stress that they're under, that I think completely impacts their health. And I think combining that with whatever they're there for acutely makes a huge difference. And it's really helped my practice a lot.
that presence with your patients is so powerful. And you don't need a lot of time in order to actually indicate that you're fully with them. So,
Right. I mean, I've also, one other thing I've done differently is when I go in, I always make sure to pull up a chair and sit down. Makes all the difference because they're like, wow, okay, she cares. Versus like slowly people trying to back out of the room, like, gotta go. Like it really, that presence does change things.
I agree. I've witnessed the same thing. Yeah.
Grace, 1 or 2 things that you're incorporating?
Yeah, so I basically, as I mentioned before, I did use IHeLp to really leverage myself into the fellowship and, get into the integrative medicine space as a new career. But yeah, I'll have to agree with Dana and Veronica. I've changed the way I practice. It's a lot of presence with patients. And as Dana said, patients do feel that. So, it's choosing when you look at a patient and their diagnosis, you're not just looking at them as a number or a symptom. You're kind of really diving deep into their lifestyle. Like I'm asking about their nutrition, exercise, sleep, and stress management. And, you kind of have to, as a provider, you have to dive deep into, okay, well, what is really causing their gut issues? What is really causing their autoimmune condition? Things like that. So it's really diving deep and really caring about the patient on a deeper level.
Thank you all so much. We're like doing amazing on time. So we're gonna go ahead and get questions from the audience. And the ways that we can do that, it's like some folks you might be more savvy about Zoom and you know how to raise your virtual Zoom hand, or you might feel more comfortable writing a question in chat. But you can also just if you can, turn your camera on so we can see you, unmute and ask your question. I always give too many options. A group. Do you have questions for each other? Oh, we have our first question. What part does analytics and research play in your program? That is an interesting question. All of our curriculum is, we're very diligent and proud that we are include the evidence, directly cite right into the learning pages, so that you can go and take a look at the supporting articles and abstracts. And we talk about the research and, like the pros and cons of like how things are researched. So some things in integrative medicine are just not using randomized controlled trials. It's not an equal way to research and look at an approach. And in integrative medicine and health, we're also looking at, okay, what is the level of risk versus what is the level of evidence, as well as the context of how long has this been traditionally used, which obviously plays a role in understanding the safety aspects of things. So I don't know if that answers enough of your question, but we don't have, it's not like you do a research paper or a study as part of the program. There's a graduation project in which you're going to demonstrate how you could apply what you've learned in IHeLp in a real world situation.
In the research for that project, you get deep into that because they want the most recent evidence-based articles or peer-reviewed journals. So you can get as deep as you want to into that during the graduation project.
Yeah, and I like how you frame that, Veronica, as deep as you want to, because we have a integrative medical informatics course as well, because we want you to be able to like, we're telling you what the latest is, but when you graduate, we want to make sure you know how to look up and figure out what is the latest evidence or studies looking at this. Is there a meta-analysis on this now or not? And so making sure you have the skills, plus we have like really cool external resources for folks to use. And you're just clarifying, yes, I'm an RN MBA, so analytics and cost justification is a big part of the things I enjoy learning. Great. Let's see. Oh, Hillary, here we go. Sorry, I'm in the midst of evening with kids, so it's loud. Totally understand. Appreciate you joining us at this hour, but how did the workload of the program fit into work and family life? You are all speaking my language of inspiration with diving to the roots of issues. I work in pediatrics and really value connecting with teens, kids, and families and equipping them to self-advocate for their health. That's a great question. Life, work, family balance.
Well, I would say for sure, if we're speaking your language, this is a great program for it, for sure. I will tell you one of the first things Fred, and I feel like Morgan and Molly did too, was say that follow the syllabus. They'll give you, the times, how long they think it'll take, what you want to dedicate for what day, follow the syllabus. I think as long as you do that, you will have pretty decent work-life balance. I think one week I was ill or something. So I got off the syllabus for a little bit. And then you realize how important it is, that time management. But I think as long as you take the advice of following the syllabus, you'll be fine.
Yeah, I completely agree. I just wanted to add that I get the kids, you might hear mine screaming right now. When I was in the program, I was pregnant, and that was with my fourth. So, and I was also working. It is a balance, but if you have multiple kids, you kind of know that balance and how to work that part of it out. But like Veronica said, following the syllabus, I was like, I mean, literally, you just go down and then I would just check stuff off. And if you did that and just, you said the hours are going to change this time, but I think I tried to commit like an hour or two per day,
Same.
every day. And it really works out pretty well. It's not as difficult as it seems. It's not like when we were in nursing school. It's nothing like that at all. Much more manageable.
And a lot of it is self-care. It's like
Yeah,
you're learning, and you're also, the time that we count every week for that syllabus is you doing self-care work, because we want you to do it. We don't want to have you figure out how to squeeze it into your life.
yeah.
Yeah, I was just going to say that we did have the self-care assignments, which were nice. There were some areas where I felt like I had to skim a little bit, and then more interested areas where I, dive deeper a little bit. But what I would do was I would save the articles and things like that as I went. So I have them for, future reference. I could go back and read it. But it's definitely doable. I was definitely the type where even if I skipped a day or two of studying, I could catch up in like a day. So it's more about, I think it's reasonable for the week, but depending on how you study, if you like more of block time or do a little bit each day, that's really up to you.
Definitely. Yeah. It's like, who is the learner? So because of the design, it is flexible, but it's structured. So it's not like, I'm going to work for this week, but I'm going to take 2 weeks off. It's every week. As I said, we're going to be really specific. Like, you need to finish this course, and you're going to do this self-care assignment. And then that's all asynchronous. So if you're a night owl, great. If you do everything on the weekends or early morning, or you piece it through, that's asynchronous, so you're set. But we do have some virtual, Veronica. We didn't have this when you were, we started this in 2024, our integrative health healing talks, which are an hour long. And there's about 6 or 7 of them throughout the program, and you get the schedule way before the program even starts. And you get to come and like see like faculty and experts. They're going to do a little bit of a deeper dive on the curriculum you've learned, but then do a live Q&A. And it's just, it's these opportunities for us to stay connected and remember we're a learning community, and you're not all by yourself, even though there's chunks of time that you are. But even online, you're going to do a reflection, and then you get to like read your classmates' responses too. So we're always, you're weaving in with your self-care team, as the panelists have mentioned. You're with a faculty mentor and a small team of like 6 to 8 other students, and those are the folks you're sharing your self-care experiences with and getting support and encouragement to be successful through the program. And they meet up on Zoom, I think 4 or 5 times online. And then, of course, we have our in-person retreat as well. All right, so Michelle says, I'm a physical therapist, just wondering if you've had a lot of allied health practitioners participate in this program. Yes, today we're highlighting our nurse practitioners, but from day one, when I was designing this program with my co-conspirator, Dr. Rocky Crocker, who retired last year. So back in 2014, when we launched, our goal was, we want interprofessional training. We want interprofessional integrative healthcare teams out there, because every one of you is making an impact and changing that patient's life or community's life. And if we were all practicing from the same foundational principle of treating the person as a partner in health, as seeing them as a whole person, mind, body, spirit, understanding like impact of lifestyle and complementary approaches that can support their health, we're going to, heal the world. That's our big vision, right? So we've had a number of physical therapists come through. We've had nurses, dietitians, psychologists, social workers, dentists, chiropractors, acupuncturists. It is very interprofessional. Our strongest representation, and it's grown over the last few years, is in the RN and NP world. And then if you bundled all the mental health and behavioral health folks together, that's our second biggest. But Michelle, we have alumni we can connect you with. And it looks like Morgan's already on that, offering that to you. But yeah, that I think is so core. And when we do our self-care groups, we don't go like, all right, you're a nurse practitioner, I'm gonna put all the nurse practitioners together. We don't do that. We want folks to be learning from each other, both of like, well, what are your challenges and like the scope of practice you have, and like, how do you get to work with other professionals who like have like talk about integrative health or medicine? You guys have anything to offer around the interprofessional aspect?
Yeah, like you said, it's a good mixture of all professions, and it's nice to bounce ideas off each other or reflect on past instances and how to manage that in the future with, equipped with our new tools. But there's definitely a good mixture of professions in the class.
Yeah, and I would say in my class, I think I remember there was a pharmacist because she was also from New York, and she was interested in the whole like supplement botanical space. So she was like thinking of business ideas of like, oh, maybe I can go into that, you know, go down that path. And there's a lot of creative ways in your specialty, right? So I think that's the good thing about integrative health. You can kind of choose your path, into whatever you're interested in. So it's great. It's good opportunities.
Yeah, and some folks you have more time with your patients. And I think like you have the opportunity, um, to speak more across what we call our 7 core areas of health, and try to support people in that way. Are there other questions that folks have? That people are mid-dinner right now. We're just trying to get off of work if you're over on the West Coast. All right, well, I'm going to take advantage of the quiet moment, but please speak up at any time. I'm going to jump and just click through a few slides. So there's some more information about what the program design looks like. So I'm going to go ahead and go back to share. It's moving. There we go. So we've had a slight adjustment in our 2026 program delivery, in which we've extended the time. It used to be a 6-month program. We've extended to 8-month to allow more breathing room for our students. So one of the questions was like how to balance things. And so, folks do that week by week syllabus, and they were pushing through, but it was like 10 hours a week we had gotten up to, and no real break times. So starting in 2026, it's an 8-month program, so 34 weeks. And the weekly syllabus is between 6 to 8 hours of expected work that the student would do. And again, we will provide very specific information about week by week so you can even plan ahead, over a month ahead of what to expect. And those include our virtual healing talks I talked about, and your self-care team meetups on Zoom. We're also including a motivational interviewing virtual workshop. And then, of course, our 4-day hands-on in-person educational retreat. If anybody has their phone, you can go ahead and scan the QR code, and you'll get the actual like outline for the entire program for 2026 and what you would experience when you're learning what. and when those healing talks are happening and when the retreat is in September. And that's just a little snapshot of part of it, but also Morgan will pop in the chat a link just in case, have the QR code function. If you don't know, completing the Integrative Health and Lifestyle program makes you eligible to sit for board certification for holistic nursing. So as long as you do it within 2 years, because they recognize the continuing nursing education credit that is provided in IHeLp, which is you only need, I think, 48 continuing nursing education credit hours, and like we're at I think 60 in IHeLp. And Dana was mentioning that she did within a couple months after graduating from IHeLp, got the books, studied, and took the test and got board certified. Is a thank you for attending. Morgan's going to send everyone an application fee waiver. So if you are interested in applying to the 2026 class, you would be able to apply for free. And just so you know, we have incentives for applying early, so that we set that at September 10th, that you would save up to $300 off your holding fee, which is a part of the tuition. It applies towards your overall tuition. And that scholarships are going to be opening soon in the summer. We're almost to the summer. It feels like that here in Tucson. But there's another QR code if you want to take a look at the application process. It's really a series of questions to get a better understanding of if you have any previous background in integrative health, what your goals are with learning, joining the program and wanting to learn integrative health, how you see yourself in the next 5 years if you had this education, as well as like verifying your licensure or credentialing. Anything else on that? Let's see. All right. Any other questions?
I have a quick question. I do see somebody on the line with a Florida area code. I want to make sure that you get your application fee waiver. I have a guess as to who you might be, but if you can unmute and let me know for sure who you are, I'll make sure that you get your application fee waiver after this call. Thank you.
Thanks, Morgan. Yes, we want to give you credit for attending. Anyway, just want to say thank you so much to our panelists, Grace, Veronica, Dana. I hope that I get to see you soon online at one of our events or in person when we have our conference coming up in a year here at the new building. It's always great to hear the stories and to see how you all are applying and just appreciate your story sharing and get the word out, because this movement is so important to take care of all our healthcare professionals out there. We need to take care of you all, and that allows you to take care of us so well. So thank you so much.
Thanks, Molly.
Thank you so much.
Thank you.
Thank you. Have a wonderful night, everyone. Morgan will send an email. Please just reach out if you have more questions.
Bye.
Have a good night.
Wonderful evening.
Thanks, everybody. Thanks to our panelists. Thank you, Molly, for moderating. And as Molly mentioned, I'll be in touch with everybody via email. Take care.
Take care.
Morgan.